Welcome to my Doctor of Nursing Practice project presentation. My name is Joan Bourne, and I am honored to present my work titled Policy Review, Therapeutic Activity Scheduling During Medical Stabilization of Pediatric Eating Disorders. This project focuses on the critical intersection of therapeutic interventions and medical stabilization in the treatment of pediatric patients with eating disorders. The aim is to examine existing policies and propose evidence-based recommendations to optimize therapeutic activity scheduling, ensuring these activities align with the medical and psychological needs of this vulnerable population. Through this policy review, I hope to contribute to the advancement of clinical practices that foster holistic care and improve outcomes for children and adolescents undergoing treatment for eating disorders. Thank you for joining me as I share the findings and implications of this important work. I would like to thank Dr. Maria Snell, Dr. Lisa Struer, Dr. Aislinn Moyer, and Dr. Margaret Geddes for their support and guidance throughout this project. This project aimed to formalize a therapeutic activity schedule for pediatric patients with eating disorders at a southeastern pediatric hospital by creating a clinical practice guideline. The therapeutic activity schedule used in current practice lacked standardized guidelines, leading to inconsistencies in its implementation. The goal of the project was to establish a more structured and consistent clinical practice guideline with a solid foundation in evidence-based treatment recommendations. A comprehensive review of current policies was conducted, and a formal clinical practice guideline was developed. To assess its quality, the Agree-To tool, a recognized standard for evaluating clinical guidelines, was used. The Agree-To assessment showed that the new policy met high-quality standards with strong scores across all areas. It was clear, well-written, and independent from funding sources. Chapter 1 of the doctoral project introduces the phenomenon of interest and reviews the doctoral student's expertise and the project's purpose and aims. It outlines the completed inquiry type, details the background and significance to the nursing profession, and discusses project support and its benefits to practice. Eating disorders disrupt eating behaviors, leading to inadequate nutrition and serious physical, psychological, and social consequences. Without treatment, they can be fatal. Severely malnourished patients are often admitted to acute care hospitals for stabilization, but treatment for the disorder itself is delayed. This delay worsens symptoms like anxiety and depression, complicating recovery and increasing resistance to necessary nutrition for medical improvement. The doctoral student, a licensed social worker and board-certified psychiatric mental health nurse, practiced at a pediatric acute care hospital in the southeastern United States. While working as a behavioral mental health nurse and case manager, the student observed high anxiety levels in patients with eating disorders between scheduled meals. Discussions with interdisciplinary team members who shared similar observations led to the development of this project. This doctoral project aimed to reduce emotional distress and improve patient outcomes through the implementation of a structured activity schedule. Due to the rapid implementation of the therapeutic activity schedule, this project evolved from an assessment of the implementation of the therapeutic activity schedule to a policy review and creation of clinical practice guidelines. This presentation explores the policy development process, evaluation methods, and key findings from the Agree-To assessment of the newly created clinical practice guideline. This study started as a prospective study. A practice problem was identified, an intervention was proposed, and data analysis was planned to explore whether the intervention had the desired effect on the practice problem. Due to the rapid implementation of the planned intervention by the research site, the project evolved into an evidence-based policy review. The doctoral student sought out the current policies guiding the implementation of the therapeutic activities schedule to ensure the current organizational policy met the methodological rigor that evidence-based practice requires. Between 2018 and 2019, approximately 5.4 million individuals in the U.S. were affected by eating disorders, with a financial impact of $65 billion. Despite increased attention, there is a lack of evidence-based treatments for children and adolescents, compounded by anxiety that worsens these disorders and prolongs waiting for specialized care. Hospital therapies like art, music, and animal-assisted therapy show promise in reducing anxiety and improving outcomes. A standardized policy approach is needed to integrate these therapies and ensure consistent multidisciplinary care, ultimately leading to better patient outcomes. This project is significant to nursing by impacting all 5 patterns of knowing. It provides empiric knowing through evidence supporting the therapeutic activity schedule, guides personalized care via ethical knowing, and reduces inequities through standardized implementation in emancipatory knowing. It fosters therapeutic relationships with personal knowing by ensuring care follows evidence-based guidelines and demonstrates aesthetic knowing by highlighting nurses' commitment to holistic care. For the healthcare industry, the project improves patient outcomes and reduces system burdens. And for APRNs, it encourages collaboration with dietitians, psychologists, and physical therapists, enhancing patient care and ensuring adherence to best practices. Support for this project has been strong, reflecting concerns about care gaps for pediatric patients with eating disorders. The Chief Nursing Officer of the project site expressed concern about negative progress in patients awaiting transfer to specialized treatment, prompting the creation of work groups to explore solutions. Key stakeholders, including the Assistant Nurse Manager, Feeding and Eating Disorders APRN, dietitian, music therapist, and child life specialist, have backed the project. The hospital's nurse scientist is assisting with project design, and discussions with clinical leadership have engaged additional stakeholders to improve care for this vulnerable population. As stated before, this project has evolved from the initial implementation of the therapeutic activity schedule to a focused policy analysis. Recognizing the increasing prevalence and acuity of eating disorders, stakeholders felt it was imperative to act quickly to implement interventions that could address common comorbidities such as anxiety. By analyzing the policy for the therapeutic activity schedule, the project ensures that patients gain predictability and access to targeted interventions designed to alleviate their anxiety. This proactive approach not only reduces anxiety levels, but also decreases the complexity of care required, ultimately lightening the load for nurses who are already managing demanding workloads. The aim is to enhance patient outcomes and support healthcare providers in delivering efficient, effective care in a timely manner. This project addresses the growing need for medical stabilization of eating disorder patients, which strains healthcare systems. Anxiety commonly co-occurs with eating disorders, complicating treatment and highlighting the need for innovative interventions. The project leverages available therapies like music, art, and animal-assisted therapy, aiming to institutionalize these interventions through supportive policies. By revising current policies on therapeutic activities, the project integrates evidence-based treatments to reduce anxiety, enhance treatment progress, and improve patient outcomes. Chapter 2 reviews current research on interventions to reduce anxiety in eating disordered patients. It outlines the literature search process, presents an integrative review, defines key concepts, and discusses the theoretical framework for the therapeutic activity schedule. The project utilized a comprehensive literature search through Maryville University's 133 databases, including Sanal Plus. Key terms like eating disorders, pediatric eating disorders, and therapeutic activities were used, with expanders for full text access and limiters for peer-reviewed articles published between 2018 and 2023. From the 196 articles evaluated, 30 relevant studies were selected based on their focus on interventions using the PICO strategy and targeted searches for therapies related to anxiety and eating disorders. This thorough approach ensured a robust literature foundation for the project. The literature review identified 30 articles focused on 3 main themes: the impact of eating disorders, the link between anxiety and eating disorders, and proposed interventions. The review highlighted the significant physiological, psychological, and financial impacts of eating disorders, contributing to increased pediatric hospital admissions. It confirmed the strong relationship between anxiety and eating disorder severity, particularly meal-related anxiety, which negatively affects treatment outcomes. Proposed interventions included pharmacological therapies and therapeutic approaches such as animal-assisted therapy, music therapy, and art therapy, which have proven effective in reducing anxiety and improving outcomes. The review also stressed the importance of a family-centered, multidisciplinary approach to treating eating disorders. The research critique underscores the importance of a thorough literature review for evaluating research quality, identifying evidence gaps, and developing the project's rationale. The review found strengths including 2 systematic reviews and 12 randomized controlled trials strengthening the evidence. However, it also noted weaknesses such as small sample sizes in 20 studies, limiting generalizability, and concerns about biases in 9 studies lacking conflict of interest disclosures. Gender imbalance with the predominance of female participants was also noted. The critique identified gaps in researching psychosocial interventions during acute hospitalization and the efficacy of therapeutic activity schedules. Additional research is needed to improve understanding and interventions for eating disordered patients. It is important to define key concepts relevant to the project. Body mass index, also known as BMI, is a measure of body fat calculated by dividing weight in kilograms by height in meters squared. Eating disorders are mental health conditions involving disordered eating habits that harm physical and psychological health. Art therapy uses creative activities like drawing or painting to help individuals express emotions and explore their thoughts. Animal-assisted therapy involves trained animals interacting with patients to provide emotional support and facilitate healing. Music therapy uses music to address emotional, physical, and social needs, led by a trained therapist to promote well-being. This DMP project reviews an evidence-based policy for a therapeutic activity schedule designed to reduce anxiety in pediatric patients hospitalized for eating disorder stabilization. It uses the model for improvement, which addresses 3 key questions. What are we trying to accomplish? How will we know a change is an improvement? What changes will help achieve improvement? The goal is to reduce anxiety through evidence-based policies. The model for improvement, using the Plan, Do, Study, Act, or PDSA cycle, supports quality improvement by identifying issues, testing interventions, and adjusting based on the results. This project starts with a policy review, gap identification, and expert evaluation using the Agree-To tool to guide revisions. A limitation is the framework's lack of a sustainability plan, which can be addressed by creating one to ensure long-term intervention success. In summary, the literature review has laid the groundwork for the DMP project. The research conducted has established a strong link between eating disorders and anxiety. Several studies have demonstrated the efficacy of treating anxiety with the proposed interventions included in the therapeutic activity schedule. The DMP project seeks to determine if current policy guiding the implementation of the therapeutic activity schedule provides the evidence-based support it needs. Chapter 3 will discuss the methodology, data collection, analysis plan, resources needed, and protection of human subjects. The inclusion criteria for this project focused on policies guiding the care of patients with eating disorders, ensuring relevance to their specific needs. Exclusion criteria removed policies unrelated to eating disorders or those not applicable to the FED team, streamlining the review to focus on effective, targeted interventions for this patient population. The project design is structured as followed. Step 1. The data collection process began after receiving IRB approval from both the research site and Maryville University. As an employee of the research site, the doctoral student had access to the online policy manual, which facilitated the identification of applicable policies throughout the implementation of the DMP scholarly project. Step 2. The DMP project committee utilized the Agree-To tool to guide the analysis of the proposed policy. This structured framework ensured a comprehensive assessment of the policy's quality against established evidence-based criteria. Step 3. Following the analysis using the Agree-To tool, the committee provided a recommendation regarding the adoption of the proposed policy, ensuring that a comprehensive evaluation process supported the project's outcome. Agree-To stands for the Appraisal of Guidelines for Research and Evaluation. It's a framework designed to assess the quality of clinical practice guidelines, or CPGs. The tool comprises 23 items that are organized into 6 key domains. These are scope and purpose, which assesses the clarity of the guidelines' objectives; stakeholder involvement, focusing on the inclusion of relevant parties in the development process; rigor of development, which looks at the methodology and quality assurance in guideline creation; clarity of presentation, ensuring recommendations are user-friendly; applicability, considering practical applications in clinical settings, editorial independence, which evaluates the influence of external factors on the recommendations. Using Agree To has many benefits. It enhances the transparency and reliability of clinical practice guidelines, making it a valuable tool for researchers, clinicians, and policymakers involved in guideline development and implementation. On the left, you will see a screenshot of a portion of the Agree To instrument. The project primarily relied on human resources with key contributors including the doctoral student, the Feeding and Eating Disorders team, and the DMP Scholarly Project Committee. This collaborative group handled the discovery, review, and analysis of relevant policies. Data analysis was conducted using SPSS software provided at no extra cost by Maryville University. The estimated cost for Fed team and DMP committee clock hours was around $1,000, covered by the research site's annual salaries. No additional costs were incurred. The budget table outlines expected expenditures, demonstrating efficient resource use to ensure the successful completion of the policy analysis. The project lasted 4 weeks, focusing on developing the therapeutic activity schedule policy. In week 1, the doctoral student reviewed existing policies to identify gaps. Week 2 involved attending the Feeding and Eating Disorders team meeting to gather insights from direct patient care staff. In week 3, the student developed the policy, collaborating with the Fed team. Week 4 concluded with a presentation to the DMP Scholarly Project Committee for feedback and refinement. This timeline ensured a comprehensive approach to enhancing care for pediatric patients with eating disorders. The project site is de-identified by describing it as a pediatric acute care hospital in the southeastern United States. Since the project involved a review of existing policies rather than direct interaction with patients or data collection involving human subjects, there was no risk to patient safety or well-being. By limiting the scope to an analysis of policies, the project ensured compliance with ethical research standards and prioritized the protection of human subjects throughout the process. This careful consideration underscores the commitment to ethical practices in healthcare research while striving to enhance policy frameworks that support pediatric patients with eating disorders. The project used quantitative and qualitative analysis with the Agree To tool to identify gaps in existing policies and assess their effectiveness. Experts in the field also reviewed the proposed policy to ensure evidence-based recommendations aligned with best practices. The final report provides a solid foundation for standardizing therapeutic activity schedules for pediatric patients with eating disorders, aiming to improve patient outcomes and create a consistent care framework. Chapter 4 discusses the methods of evaluation, analysis, and presentation of data, results, and key findings. The doctoral student used the Agree To tool to assess the methodological rigor, transparency, and quality of clinical practice guidelines. The tool evaluates 23 items across 6 domains, scoring each on a 7-point Likert scale to calculate standardized percentages for performance. Widely validated and ethically approved by the Institutional Review Board, the Agree To tool provides a reliable foundation for improving and standardizing therapeutic activity schedules for pediatric patients. SPSS software was utilized for comprehensive data analysis, ensuring all data was included. Qualitative analysis involved content analysis of policy documents and structured interviews with the Fed team and hospital administrators to gain insight into current practices, gaps, and opportunities for improvement. Quantitatively, the Agree To scores were analyzed using descriptive statistics to summarize results and establish a baseline for evaluating clinical practice guidelines. A various assessment was conducted to identify significant differences in scores between raters, pinpointing areas for further review. The policy review revealed the absence of a formal policy guiding the therapeutic activity schedule in the pediatric inpatient unit. To address this, a comprehensive policy was developed, outlining the target population, activities such as art, music, and yoga, roles, and individualization based on therapeutic levels. The evaluations showed strong results in scope, clarity, and editorial independence, but identified areas for improvement, such as broader stakeholder involvement, clearer evidence limitations, and addressing implementation barriers. While some suggestions were outside the project scope, they provide valuable insights for future improvements. Overall, the results highlight the need for a robust policy to support pediatric patients with eating disorders. The project demonstrated positive outcomes for pediatric patients with eating disorders, showing the therapeutic activity schedule's effectiveness. Stakeholder involvement was high, enhancing the applicability of the guideline. The agreed-to evaluation confirmed the guidelines' clarity and rigor, ensuring it meets high-quality standards. Chapter 5 highlights lessons learned, emphasizing the importance of ongoing stakeholder engagement. It discusses how the results support adopting evidence-based practices in healthcare, particularly for sensitive populations like children with eating disorders. The therapeutic activity schedule policy should be adopted by the Feeding and Eating Disorders Unit and shared with similar programs to standardize care. Successful implementation depends on strong leadership, fed team commitment, and addressing barriers like resistance and resource limitations. Ongoing monitoring is needed to manage unintended consequences. Incorporating feedback from patients, families, and interprofessional teams will strengthen evaluations and improve the policy's effectiveness and patient outcomes. This project aligns with key D&P essentials. It advocates for improved care for vulnerable pediatric patients, demonstrates leadership in influencing healthcare delivery, and supports clinical prevention by addressing emotional well-being. The policy development involved collaboration with various stakeholders, highlighting the importance of interprofessional teamwork in enhancing patient outcomes. Overall, the project reflects a comprehensive approach to improving healthcare for pediatric patients with eating disorders. Disseminating the project's findings through healthcare policy journals and national conferences like the American Academy of Pediatrics Conference will reach decision makers and specialists, promoting evidence-based policy adoption and the integration of therapeutic activity schedules in medical stabilization practices. These methods aim to maximize impact and encourage widespread implementation. Pediatric eating disorders present significant challenges during medical stabilization, requiring interventions that are both evidence-based and tailored to the unique needs of this population. The therapeutic activity schedule policy, developed through this project, provides a structured framework for implementing developmentally appropriate therapeutic interventions designed to improve patient outcomes. Key outcomes of this initiative include enhanced patient engagement, reduced stress levels during hospitalization, and a clear, standardized process for implementing the schedule effectively. To amplify the project's impact, dissemination efforts will focus on submitting findings to healthcare policy journals and presenting at professional conferences. These efforts aim to influence broader adoption of therapeutic activity schedules, promoting consistency and improved care across pediatric healthcare settings. Thank you for taking the time to view this presentation. I appreciate your attention to the importance of formalizing therapeutic activity schedules to improve care for pediatric patients with eating disorders. This initiative not only aims to standardize interventions, but also seeks to reduce distress and enhance patient outcomes during medical stabilization. I would like to express my deepest gratitude to my committee members, colleagues, and everyone at Maryville University for their unwavering support and guidance throughout this project. Their expertise has been instrumental in shaping this work. Finally, for those interested in further details, a complete list of references is included at the end of this presentation. Thank you once again for your time and your commitment to advancing care in this critical area of healthcare. Together, we can make a lasting impact on the lives of our patients.